Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, the prognosis was not good when 2 American missionaries were infected with Ebola in West Africa in July. The virus has killed more than 1,300 people there. John?
The Americans were flown to Atlanta for urgent treatment. Now, both have been released from the hospital. One of them called his recovery miraculous.
I'm thrilled to be alive, to be well, and to be reunited with my family.
After nearly 3 weeks in an isolation unit at Emory University Hospital, Dr. Kent Brantley was discharged and declared Ebola-free by his team of doctors and nurses.
You treated me with expertise, yet with such tenderness and compassion. For the last 3 weeks, you have been my friends and my family.
Brantley and aid worker Nancy Wrightbull were flown to the U.S. for emergency treatment after becoming infected with Ebola while doing missionary work in Liberia. Wrightbull left the hospital earlier this week, and doctors say that neither one of them is contagious.
The medical staff here at Emory is confident that the discharge from the hospital of both of these patients poses no public health threat.
That was made clear by the warm embraces Brantley received from his team. A stark contrast to his arrival in the U.S. earlier this month, when he became the first Ebola patient ever treated on American soil. While there was cause for celebration here, halfway around the world in Western Africa, the Ebola epidemic is raging. The current outbreak has sickened nearly 2,500 people and killed more than 1,300.
We are hopeful that what we've learned here will assist our colleagues in Africa in caring for these critically ill patients.
Please do not stop praying for the people of Liberia and West Africa and for a quick end to this Ebola epidemic.
John, it almost seemed like Dr. Brantley's team went out of their way to hug him publicly.
Yeah, I think that was highly significant. There's been so much fear, so much ignorance about how it's spread, and nothing says, I don't think you have Ebola, than hugging somebody like that. So I think that was very significant, and that's in contrast to in Africa, where people who have recovered from Ebola come back to their villages and often they're ostracized.
We heard the doctor there say we've learned so much about treating Ebola. What do you think they learned from having 2 people right in their midst with it?
Well, the doctor who headed the team, Dr. Ribner, said that they learned about, nitty-gritty things like managing fluids and electrolytes, correcting clotting factors, and they plan to give instructions to people on the ground in Africa in the hopes that it can help treating Ebola there.
Wonderful to see they're both doing better.
Oh, great.
Also this week, Consumer Reports has a fishbone to pick with the FDA. The government recently came out with guidelines urging people to eat more fish. For the first time, the FDA set a minimum level for pregnant women between 8 and 12 ounces a week. But Consumer Reports reviewed that data and found reason for concern over mercury in some kinds of fish. So these are 2 very different findings from almost the same data.
Right. It's interesting, Vanita. This is the great fish debate, and it's just going to keep going and going. But, so ultimately, a few months ago, the FDA, they responded to the data that a lot of pregnant women are avoiding fish altogether out of concerns around mercury or confusion about which fish had mercury. So they released a list of safe fish to have, and they said all pregnant women should have 8 to 12 ounces a week. Now, on that list was chunk white tuna in cans, and that was considered low mercury. Later, Consumer Reports did their own analysis of many forms of tuna and found that some of them had higher levels of mercury than we thought before. So while the FDA is saying, make sure you get enough fish, Consumer Reports came in and said, you have enough fish, but avoid tuna altogether if you're pregnant.
We reached out to the FDA for comment, and they told us that the Consumer Reports analysis focuses exclusively on the mercury levels and not on nutritional values. What they said was, quote, the methodology employed by Consumer Reports overestimates the negative effects and overlooks the strong body of scientific evidence published in the last decade. So, Holly, what should we be doing?
Well, it's a valid point. Here's the thing. Fish is actually great for the developing baby's brain. It's high in omega-3s. It's a great lean source of protein. Mercury, on the other hand, is not good for the fetus's brain when they're at their most vulnerable. I think it's really important that we focus on low mercury fish. I think it's fine to take tuna off the list completely as long as you're not taking fish off the list completely. Really focus on salmon. Tilapia is a great one, catfish, cod. There are so many options out there that we can avoid the tuna.
I keep hearing that mercury is not good, but truth be told, I don't know why mercury is not good. What does it do?
Well, one of the main things, Vanita, is it's a nerve toxin. So you can have neurotoxicity, you can have tremor, problems with balance, it can cause psychiatric problems. And then, of course, there's great concern from the developing fetus that it could cause abnormalities. There have been some studies linking it to problems in development. So it is something to be concerned about.
A new drug helps bald people grow new hair. Pills were given to 12 people with alopecia areata. It's an autoimmune disease that affects about 1% of men and women. Most of the 12 test subjects regrew a full head of hair in 4 months. But guys, we're out of luck. There's no evidence the drug will help with the more common male pattern baldness.
A University of North Carolina study this week finds a substantial number of older patients with limited life expectancy continue to have routine cancer screenings. But those checks for prostate, breast, cervical, and colorectal cancer are unlikely to benefit them. Why is that?
You know, this was a great large study, Vanita. It really zoned in on older people, particularly people who had a life expectancy less than 9 years. They found that many of those people were still being screened routinely for conditions which may not really affect them. They're more likely to die from some other cause than the things they're being screened for. So it really raises the question of how much screening is too much and when should we say when? And hopefully some of this data will help us really zone in on what we're using the screening for and what we're going to do with it.
So, Johnny, is there a cutoff point then for screenings for these type of cancers at that age?
It's hard to make these blanket statements. I mean, one of the problems is my patients don't come with an expiration date like my credit card does. So, how do you know when they have only 10 years left? And I think some of the smart thinking now is around not necessarily not doing a bunch of the screening, but if you do the screening, like you do a PSA, not necessarily rushing to do surgery. About 80%, I spoke to a leading urologist today, about 80% of the abnormalities on PSA can actually be just followed with what's called active surveillance. So it's just sort of personalized medicine, being a little smarter about it.
Thinking of each patient really as an individual, that's sort of how you can figure it out.
All right, finally, the Wall Street Journal looked at the real reason why we yawn. Researchers say stress and anxiety make our brains hot. So yawning keeps the brain cool and working at its peak efficiency. And yes, yawning is contagious. It evolved from animals who used yawning as a signal to keep the group alert for potential threats.
So just remember, the next time you hear something on Morning Rounds that makes you yawn, it's our way of keeping you alert.
There you go. I always catch a yawn from my Yorkshire Terrier. They're talking about animals keeping us alert. She yawns, and then the entire family follows her. So I hope she's not yawning during Morning Rounds, though.
We should also, no, nobody would do that, I'm sure. Hey, we should note it's our 1-year anniversary of having you here every Saturday morning.
Happy anniversary with our CBS This Morning mugs.
Yes.
Cheers.
We'll
Cheers.
be dining on that delicious spread you brought in for us this morning. Dr. John LaPook, Dr. Holly Phillips, thank you both so much.